Okay, Councillor Corthorne, we're live. You can start the meeting when you're ready.
Welcome to the virtual meeting of the Social Care, Housing and Public Health Policy Review Committee. This virtual meeting is also being broadcast simultaneously on the Council's YouTube channel, Hillingdon, London. I am Councillor Philip Corthorne and I am Chairman of this meeting. Before we start, some important online housekeeping for everyone present. Please ensure any mobile phones around you are on silent. If you are wearing a headset, please ensure your microphone is away from your mouth to avoid noise when not speaking. Please keep microphone muted when not speaking and then unmute to speak. Only one person may speak at a time and I as chairman will call those to speak. Now before we move on to the agenda, I'd like to do a roll call of the councillors present to confirm attendance. Please indicate you are present when I say your name. Councillor McCarner.
Good evening, I'm present.
Evening. Councillor Cooper. I think Councillor Cooper's experiencing some IT difficulty, perhaps. I'll move on. Councillor DeVille.
Good evening, I'm present.
Evening. Councillor Eggington.
Good evening, I'm present.
Thank you. Councillor Gardner.
Good evening, I'm present.
Thank you. Councillor Hagar.
Good evening everyone, I'm present.
Councillor Rodriguez.
Good evening, I'm present.
Thank you. And Councillor Tuckwell, finally.
Good evening, I am present.
Thank you very much. Thank you. Also, please can the officers present indicate they are in the meeting. So Mark Billings.
Yes, present.
Thank you. Debbie Weller.
Good evening, yes, present.
And last but by no means least, Steve Clark.
Evening, Chairman, present.
Thank you. Now, there's a possibility of us seeing Dan Kennedy and Tony Zaman, but I'm not sure they're with us at the moment, but they may join us at some point. Okay. With that, in terms of technical meeting control, if any councillor leaves the virtual meeting partway through for a period of time, for example, for a loss of connection, I will continue the meeting unless we are not quorate, which for our purposes is 3 councillors. Coming now to the agenda, apologies for absence.
No apologies for absence this evening, Chairman, but it's noted that Councillor Cooper isn't on the call at the moment.
Indeed, thank you. Number 2, declarations of interest in matters before the meeting. There don't appear to be any being declared, so I'll move on there. Number 3, to receive and agree to the minutes of the last meeting for our meeting on the 9th of February. Can we take those as agreed? Councillor Eggington.
If I may, Chair, there's reference in the minutes to some information which was going to be provided, and I'm a bit worried that we only received that information yesterday, and it's not really been possible to simulate exactly what is being offered, but I think it would be helpful if we could look again at the update, the zero carbon commitment, because it doesn't really seem to, the information we've been provided doesn't really seem to answer all of the information which was promised.
Thank you for that. I mean, just in response to that, yes, I do take your point, and I made a point of checking the minutes and making sure we had what we did have, and I instigated what you have received. I think that's something we can certainly look at moving forward, and I think any further discussion on that perhaps we can pick up offline, since David Haygarth isn't here to advise us, but the point is noted and well made. Let's take it offline, if I may suggest that, please. If Councillor McQuan is indicating as well.
Yes, thank you, Chairman. On page 3, I just wanted to pick up the second bullet point at the bottom there. So it should read as early help interventions rather than early health. So just that needs to be corrected, the change. Thank you, Steve.
Okay, Steve's nodding, thumbs up. Okay. Any other indications on the minutes at all? No.
If I could come in there, Chairman, on,
beg pardon, yes.
just on Councillor Egginson's point, one of the resolutions from the housing energy item was that a more detailed report will come on the matter, will be brought back to the committee in due course. So would that satisfy Councillor Eggington that's kind of in the pipeline to come back to the committee?
I would like to have a firm date for that. I think I'm not sure when the appropriate juncture will be and who's going to decide when that's going to be appropriate. But I think it would be useful to try and put it in our work programme, perhaps.
Yep. Okay.
Right, Chair.
Let's pick that up when we get to the work programme, but noted for now, Tony. Thank you for that. Okay, right. Can we move on from the minutes now of the last meeting? Everyone's happy? Okay, let's do that. And then point 4 on the agenda, to confirm public and private reports. So all items to be heard in part 1 as public items. So just to confirm that. And with that, we come to our first report for the evening, which is the update on the Hillingdon Homelessness Prevention and Rough Sleeping Strategy 2019 to 2024. And we're going to hear from Mark Billings, Head of Housing Options and Homelessness Standards, and Debbie Weller, Policy Manager Housing. So I'll say over to you, officers, please.
Thank you, Chairman. If it's okay, I'm just going to do a quick introduction, and then we can pass over for questions. So it's a legal requirement for the local authority to have a homeless strategy, and this has been the case since 2002. Recent changes in legislation have also required us to specifically add rough sleeping in the title. Encouragement as such from the government to ensure we include this specific work with this client group, which would also then include the pre-rough sleeper, which would then lead on to single homeless applicants. The strategy went live in 2019 and is a 5-year strategy. It is based on 6 priority work streams, which are listed in section 1 of the report, which you have. Individually, the work streams highlight key areas of upstream homeless prevention, access to affordable housing options, and how important it is to deliver with partners. The work streams together show the Council's intention to lead change and to work together to support our most vulnerable residents and those that just need a helping hand. Sitting alongside the strategy sits our action plan, and this action plan goes into the details of the work streams and is with your papers. COVID has shown us how important it is to have an accessible and responsive service. Our rough sleeper work, as a result of the Everyone In project by the government, has seen over 250 rough sleepers come through our service since April last year. We opened a brand new rough sleeper hostel in 24 hours last March, and this has been highly successful. We have pushed health out, we have assessed mental health needs, and our officers and our partners have undoubtedly saved lives. We are very proud of the way our officers have responded, and in the government's annual rough sleeper report that was published in February, Hillingdon was highlighted as the borough with the largest drop of rough sleepers in England over the past year. COVID has also brought immense challenges though. We have seen an increase in our homeless approaches, we have seen an increase in domestic abuse cases, and although we welcome the government having a moratorium on evictions, we are very concerned with future homelessness when the courts reopen, which is at the moment scheduled for the end of May. So we hope that the report was insightful, and then we open the floor to questions. Thank you, Chairman.
Thank you very much, Mark, for that. A very full report, plenty in there, lots of positive things happening and lots of challenges. We know that too. I'll say a bit more about that later on, but for now, shall we open up for questions? Now, I think, because Councillor Gardner indicating, are you? I think, Councillor Gardner? Please, go ahead.
Yeah, I hope you don't mind. I've got a few questions that I'm going to throw at Mark.
We'll go ahead. They may coincide with others anyway, so yeah. they may take some others out.
First of all, I appreciate the fact that we've managed to house a lot of rough sleepers, but also I have to say that through, because of obviously where I live and the ward I represent, lots of the rough sleepers, believe it or not, when the Brexit came in, they've actually gone back to places like Eastern Europe, because I've spoken to several people who knew them and who've been working with them, right? Also, you say that the domestic abuse has gone through the roof. Well, tell me about it. I know all about that. On paragraph 13, slightly concerned, at the bottom it says, specialist homeless prevention officers are being identified to lead on domestic abuse. Arrangements will be made for domestic abuse advocates to meet with staff. Who are the domestic abuse advocates? Right, that's that one. Sorry. I'm glad that the landlord forum is starting up again, because I think they're sadly lacking in some of the initiatives, or the lack of initiative. Also, something that I've been thinking about for ages, actually I've mentioned it several occasions, in terms of downsizing, can we have some sort of publicity scheme to let people know all about downsizing? Because I've spoken to people who are living in 3 and 4 bedroom houses, maybe there's only a couple, and they didn't even know anything about the downsizing. So that I think, can we please push that publicity wise? And the other thing, paragraph 36, you're saying there's substantial works carried out at the YMCA. I assume that's the YMCA in Hayes Town. I delivered some things there the other day, and according to the staff, there are actually only 15 residents in situ there at the moment. So I'm intrigued to know why there's only 15. If you've made, they've converted a lot of the rooms. And also, we say, how long is temporary when we talk about putting somebody in temporary housing? Because I get to the stage where I don't know what to say to people when they say they've been put into temporary. How long do you think I'm going to be here, Janet? And I genuinely don't know what to say, because I know people have been in temporary accommodation 2 or 3 years, and I think that's about it. So, is that okay?
Thanks, Councillor Gardner. You touched on one of my questions, but I've captured all those, Mark. Are you okay with them? Domestic abuse advocates, downsizing, YMCA, and temporary accommodation.
If I go in reverse order there, so temporary accommodation, of course, as we know, if a family or a household approaches and we have to place as an emergency, then they go into temporary accommodation while we make that assessment of their needs, and then if we approve the application, approve their homeless case, they would remain in that temporary accommodation until we could find them a suitable and affordable housing option. And of course, for us as a local authority, that could either be via a social housing, via the housing register, or it could be a private rented property. In all honesty, social housing can be several years, and so the idea that it's the word temporary, it's obviously not correct, and it's a phrase that we use as a local authority because it relates that it's not a settled housing solution. So it's a temporary housing solution, hence the name temporary accommodation. And so yes, for our residents, they're aware they're in temporary, and of course we know the numbers of households that we have waiting for a permanent property, and we know also that some families aren't suitable for the private rented sector, maybe because of their income levels or the areas that they need to live in, and so they may then have to stay in temporary accommodation for longer than we would want. So unfortunately, although we can't give a definitive date for how long it will be, it certainly can be in some instances for several years, unfortunately. But is sort of, Councillor Gardner, is that okay for an answer on that? I know it's not an ideal answer, but it's just an understanding of what the actual term means.
Yeah, I mean, that's okay. I mean, what I do when people say how long's temporary, I do the classic how long's a piece of string, because none of us actually know. But it's just that I think when people are put into temporary, I think they should be told this could be X amount of months, or this could be maybe a couple of years, because I think they're under some sort of strange illusion that once they're approved, after the assessment's done, that they'll be getting somewhere permanent quite quickly. And we all know that's not going to happen. But I just think we ought to be more realistic at the point when we're helping them at the initial stages.
we're under a legal obligation that the housing plan that we carry out for them at the opening stage or the prevention stage actually carries on with them until we can settle them permanently. And so the idea that we're in constant communication with them has been a legal requirement with us since the Homeless Reduction Act came in. And so every resident we deal with will have a housing plan, and then as a service. Will be in contact with them. It's not, on a regular basis, just to look at their circumstances, almost like to look at how we can resettle them into a housing solution. And so if any resident does come to you, we would say ask them for a copy of their housing plan, and if it hasn't been updated for a while, then that's an error by us. But please come back to us to say, could I see a copy of their latest housing plan? And if they've given you obviously their permission, then that will list chronologically all the work we've been doing with them up until that stage.
Yeah.
Thanks, Mark.
Yep. In regard to the YMCA, that's actually a members' inquiry, Councillor Gardner, that I've got to come back to tomorrow. But we have spoken to the YMCA, because when you said there's only 15 residents there, that did come as quite a shock to us. And actually, they've told us that they're actually nearly at 100% capacity, which is about 100 residents. And so for everyone sort of on the call, the YMCA was about 70 rooms. But they made a decision a few years ago that actually there is a number of self-contained flats on the lower floors, and they were going to be converted into rooms as well. So we've been working with the YMCA to rehouse the families, the young families that were in the flats on the lower floors, and they were converting them into rooms. But they have told us they're nearly at 100% capacity. They've got about 3 voids at the moment, they've told us, which we're working to get filled as quickly as possible. In regard to downsizing, we're very keen on promoting downsizing. We know we have to free up these larger properties. There's actually a number of bits of work going on at the moment, including looking at sort of all of our households that we know are under occupying and contacting them directly, but also how we can promote it via Hillingdon People and via other sources, so people are aware of actually that we if they would like to sort of move into a smaller property, we'll almost handhold them into a smaller unit that will then free up that property for a larger household. And we're looking at that at the moment, Councillor Gardner. But yes, please expect that we'll be doing a lot more work, and it'll be a lot more visible about how we contact under occupiers. With domestic abuse, we have got officers identified in the service already, and apologies, the report should say that officers have been identified there. And what we were very aware of is that people, residents coming to us, and they've come from a domestic abuse situation. We didn't want having a group of sort of 20 caseworkers who you could go to. We wanted it to be a lot more specialist. And so we've identified a couple of officers in our homeless prevention team. So for applicants who are coming in, it's a much more holistic service. You'll go to one of these, and they're both female officers. You'll go to these officers, and actually because they're dedicated to it, there's a lot more. It's a softer interview. Rather than sort of spreading it out amongst our homeless prevention team. The officers we're referring to come in is part of our DAHA accreditation, which we're pushing through now. And so as that continues, we'll be able to give you more updates of what that looks like in reality.
Yeah, I suspect that I know who the 2 officers are. Anyway, can I just come back on you about the YMCA? When I'll be perfectly honest with you, I was taking some stuff down there, and I actually said who I was, so that they knew that I was a local authority councillor. And I said, how many residents you've got? And she said 15. She didn't say 50, she said 15. So, maybe they thought I was a lunatic, I don't know, but...
I think we'll all be interested to see the outcome of the response that Mark's putting together. But thanks for raising that, Janet. No, that's a good call. Thank you. Now, Councillor Tuckwell, you're indicating.
Yes, thank you, Mr. Chairman. Yeah, really good report. I think it's nicely laid out. The priorities, I think we all know, all sort of have logical links between them. But my question is quite a simple one, really, and it's in relation to priority 1. And it talks around how the council's website has been updated to ensure that clients and partners can see the services to access support. But my question is, what if someone doesn't have access to the council's website? You know, if they're a rough sleeper themselves, or as councillors, we quite often have concerned residents make contact about a rough sleeper in the locality. So, is there anything else that's being done to sort of promote where these access to housing advice can be made available?
Mark?
Yeah, I think the important thing to say there is actually since we launched an online system a few years ago as part of our response to the Homeless Reduction Act, and actually it's one of the it's quite an advanced system. It allows for a lot of self-service, which is excellent, and actually it does allow residents sort of to come in, make an appointment with us, and we can almost assess an armchair assessment as such, desktop assessments, and get back in touch with them without them having to come into the office. Obviously, though, we're very conscious of those who don't have access to IT. Part of our COVID response, you'll notice, is that we never closed our access at the Civic Centre. Our homeless reception is open at the moment. It was closed for a short period at the beginning of last year, but that doesn't mean we were closed. We had officers in the building, and actually, if you came into the Civic Centre from sort of last April to summer, you'll notice that the majority of residents sort of in the corporate reception were waiting to see us, and so it was very important that we had that frontline approach. As part of our access to rough sleepers, we have an outreach team who's in the borough most nights of the week at the moment, and we do encourage residents to report any rough sleeper through StreetLink, which is an online notification system. Actually, we're looking now about how we can get more information on StreetLink out to local residents, because we do want to be notified of sort of rough sleepers as soon as possible. Our rough sleeper count last year, which was last November, still picked up sort of a handful of residents, a handful of rough sleepers in the borough that we are sort of currently trying to work with. StreetLink is a very useful reporting tool. We certainly understand that the access on the website is one part, but we're very conscious of sort of being visible within the community still, and part of our partnership work, which is priority 6, is actually is also them being aware of how they can access us as well. So if someone goes to Bell Farm Christian Centre, if someone accesses the food bank, that actually, and if they are concerned, they can directly contact us as well. So it's not only having our reception open, which is very important, and obviously if you come into 2 North on the Civic, you'll notice we're still quite a busy service there at the moment, but it's also making sure our partners are aware of how to contact us as well. And then separately to that is the work with StreetLink for rough sleep, for members of the public to notify rough sleepers to us directly.
Thank you.
No, thank you. I just by way of feedback, I used StreetLink myself last weekend, and just say it was quite an easy to use application, and that was after a number of residents contacted me about a particular situation. So yeah, I'd recommend that.
Good, thank you. And it is it's an app on the phone, and we've done some work on that actually, and there's some thematic maps we've produced to look at where we're getting the approaches from. StreetLink does allow us to sort of move intelligence upstream as well. So when our outreach teams are out, we can go to specific areas in the borough, which is very important for us.
Thank you for that, Mark. And now, Councillor Hagar, you've been waiting patiently.
Thank you, Chair. Great report. I think we do really well actually in Hillingdon with our homeless. I know it's always a challenge with every borough, and I too have used a StreetLink, and I think they do really incredible for those that are homeless actually and finding their way to the street. Good comprehensive report. There's 2 questions actually I've got in the report. Most of them allocate to page 7. On number 12, we know that obviously we're going to have a massive increase in response to COVID with the evictions. Obviously it's been at a standstill at the moment, but we don't know what we're going to land up with the future. We don't know whether landlords are going to have to sell their properties, which will mean there'll be a lot less rentable properties, and it could be quite a challenge all told. So I'm wondering what we're actually doing and how we're looking to manage that. The fact that we could actually have less properties that are rental, and then what are we going to do with those people? So this is landlords that are renting their properties and decided not to now because of the mortgages and have got to sell. Also with regards to furlong, so the furlong schemes when they stop as well and people haven't got jobs. And then the other part is I'm really pleased to see about our P3 system being used. We've got on here that it's to be significantly expanded. I wonder if you could explain what significantly expanded is. You know, again, we're aware that a lot of young children are coming out and they haven't got anywhere to go, especially with the families. So those two questions, really. Thank you. Thank you, Chair.
If you would, please, Mark.
Yeah, it's very exciting with P3 so at the moment, actually. So as we're all aware, P3 are a specialist sort of housing association and charity, not just based in Hillingdon. They're nationwide, who do very good work with young people. And obviously for a while now in Hillingdon, suddenly 10, 15 years, we've commissioned them along with our colleagues in Children's Social Services to run and manage accommodation on our behalf. For us at the moment, they're commissioned to run a young person housing advice service for 18 to 25-year-olds. And obviously, I know COVID has changed the way they're delivering that service at the moment, but if you ever were down in their office, which was sort of down in the south of the borough, it's almost like a beanbag office as such, and it's very approachable, and it's a completely different approach from walking into the civic centre and sitting behind a screen and having what you could see as quite a cold interview, walking past a security guard, etc. And so when you're looking at a young person who may not want to approach you anyway, who may see the council as sort of an authority figure, and then you look at P3, who are actually very approachable, then it makes complete sense for us to sort of enhance the work we do with P3, because it's very rarely is homelessness the only situation with a young person. They may be living in an overcrowded situation in a family home, but actually they may also be having issues with access to education, training, etc. The old NEAT phrase, so not in education, employment or training. And so actually, how can we support young people in the borough more holistically? And actually what we've been doing with P3 over the last year is looking at how we can enhance their service and how we can commission them for more young people to go through them, and how they can work more directly in supporting us with our homeless prevention duty. And so at the moment, we're talking with Councillor Lavery in how we can enhance that provision. And so our intention is to really look at a one-stop shop for young person homelessness, and that's what we're looking at the moment. In London, it will be groundbreaking if we're being honest. We've got a lot of the MHCLG is very keen on what we're doing. If you look outside of London, such as in Birmingham and Bristol, they have quite good upstream sort of young person services already. So all I can say for that is sort of watch this space, and as soon as we can be more specific, we'll get some details out to you. We've certainly noticed the upcoming risk with ASDs. I might stop there for a second because Debbie's put her hand up. So Debbie, do you want to come in on the P3 thing there?
Debbie?
Yes, well, yeah. Well, to be honest, it wasn't so much specifically about the P3 thing, but just about the kind of pressures that we may get through over the next year with the sort of increase in homelessness. And I think it's certainly true that with there's the quite welcome stay on evictions, but obviously at some point that's going to start to work its way through the system. We are expecting that we will see increased presentations to the service. We don't have any one particular solution to that, but really are rather sort of looking in a level of detail at the kind of range of options available to us. So we're doing sort of modelling work at the moment, which is looking at both the sort of increase due to the evictions and other potential pressures on the service. In quite a detailed way, looking at the sort of different bed sizes, the different routes that people come through to us, and the supply solutions available to us, and really just looking to at what we can do to just increase the amount of housing available to us, both in the private and public sector, but also looking closely at how we use our own stock and how we might alter some of those processes to assist with what's expected to be an increase in homelessness. I mean, it's very difficult to predict precisely how much that's likely to be, and I think as the policy landscape keeps kind of changing and pushing the date forward, it's also difficult to know precisely when it will come through. But at the moment, I think we're thinking in terms of around about a 20% increase in terms of people who will need temporary accommodation or some of the solution during the year.
Okay, Councillor Haggart. Councillor, are you happy with those responses, Councillor Haggart?
Yes, thank you so much. They were very detailed. It's good to hear that we're on top of it. So I'm happy with that we're looking ahead and we're on top of the game, so to speak. Thank you, Chair.
Lovely, thank you. Councillor McQuarrie.
Thank you, Chair. Actually, Councillor Haggart beat me to it with her question about supporting young people, but I do have a supplementary, if I may. Paragraph 24, the figures given, 11 rough sleepers were counted in our annual count. I was just wondering how many of those 11 are young people?
Mark, can you help with that?
I will have to review. It's not. I would have thought it's going to be actually 0 of those from the count last year. But actually, what I can do is we can go away and actually analyse all the. We've got the age ranges of all our rough sleepers, so we can come back and we can tell you how many were young people under the age of 25.
Information to follow by the sound of it.
Yeah.
Okay. Thank you for that, Mark. No one else is indicating at the moment. In which case I'll raise just a couple of things. I mean, certainly on the rough sleeping side of things, we really have come on leaps and bounds in terms of what we do. I mean, we've had the night shelter for many years. Of course, this year it's been different because the position has been that we have accommodation readily available for rough sleepers, and that's very much the way of things moving forward now. And I think that if anything good comes out of this dreadful 12 months that we've had, then better provision moving forward is surely one of them. Now, we were talking, Mark, weren't we, in my dying days as a cabinet member, about bids that were going in around funding for supported housing units to make that happen. On a Hillingdon sort of perspective, and I wonder if you can say a bit about where we've got to with that, please, if you would.
Yeah, absolutely. So part of the M8CLG sort of rough sleeper grant has allowed us to commission sort of extra supported housing units over the last couple of years. One of our key partners for this has been Trinity Homeless Projects, and last year they brought on an additional 40 bed spaces for us in basically small HMOs. Which if you know Trinity, so these small HMOs, they're very much homes. So the idea is they're not large hostels. It's the idea that you once you settle in, you're able to sort of to live with the other residents. And it really is sort of a pathway then to independence. Rough sleeper grant money for this year is also allowing us to sort of increase that supported housing provision as well, and we actually have Trinity delivering another 10 bed spaces within the next year too. Now there's a number of sort of additional work streams to that as well that we're currently looking at. I know Councillor Gardner is very keen that we look at Jupiter House down in Hayes, which is the old foyer, which hasn't been used for a number of years now. So we're very active with the Housing Association Home Group at the moment to look at what we can do to bring that foyer back into use as well. We're also sort of looking at increasing our work with sort of our move on into studio flats and private rented for our ex-rough sleeper and single homeless population. And part of our grant funding for next year is looking at an enhanced floating support service. So actually we have a pathway model that you come off the street into our rough sleeper hostels, and that's Olympic House at the moment. We keep your stay in temporary accommodation as short as possible. We then look to sort of move you into one of our supported housing units with Trinity. If that's suitable for you, it may be that you can move straight into the private rented sector. And then we look to, and we have grant money to be able to pay for deposits and rent in advance to get you into the private rented sector. And if we get this pathway working well, it means that as we move people moving into the private rented sector with the right floating support, it's very important for us how we work with an individual about not only their sort of housing needs, but their health needs, in order that they can settle into a sort of their private rented accommodation. But by doing that, we can then move someone out of supported to get someone in through the front door again. So it really is a wheel, and we're very lucky at the moment with government grants that actually going into 2021-22, this can all be funded through what's called Rough Sleeper Initiative 4. So this is now the 4th year that the government has made Rough Sleeper funding available. So and Councillor Corthorne, as you said, the journey we've come along on the last couple of years has really been fantastic. To not need a winter shelter this winter because of the resources we've put in place was excellent. And of course, the government's intention is we eradicate rough sleeping by the end of this Parliament, and we're certainly going to give a good stab at that in Hillingdon. Indeed.
Thank you for that, Mark. Now, no one else is indicating from what I can see. So, in which case, I'll just wind up by just making a few further comments. I mean, I think the report, as we say, is extremely positive, and then against a very, very difficult backdrop. There's been some tremendous work going on in a number of areas of service, which is very challenging. The focus on improvement is tremendous. As I say, amazing strides in rough sleeping. The development of the development of partnership working is all extremely positive as well. So I'd like to ask you to take our thanks back to your colleagues for all you've done in very challenging circumstances. And on a personal note as well, my thanks to you both, because a fair amount of this reporting period was on my watch as a cabinet member. So thank you for that. And if there are no other comments, again, thank you once again. Can we go back to recommendation at the front of the report that we note the progress made in delivering homelessness prevention and rough sleeping strategy? Is that recommendation agreed? Can we take that? Okay, seems to be. Thank you very much. Okay, thank you, Mark. Thank you, Debbie. Thank you, Chairman. Lovely. Great. We'll then come on to the next item on the agenda, which is the autism review. So you'll recall last time round, we were talking about the themes that we felt should be drawn from the review from the various witness sessions that we had, and officers have come back and reported back on those various things, and we have the report here with a number of recommendations, and I won't talk about each and every one. There are one or two that I do want to comment on, though. Essentially, as a committee, there are three things we can do this evening. We can either take these recommendations as they stand, these draft recommendations to Cabinet. If we think there are one or two that need a bit of tweaking as far as language is concerned, or one or two minor alterations, we can certainly do that. We can take it offline. If there's anything we think warrants more a bigger piece of work, we can look at that, but that may necessitate a report back to another committee. So those are the options before us, and we could amend recommendations as well. So really, my comment on one or two of the recommendations here. Recommendation 2 deals with training. Now, if you remember, we were talking about making training mandatory. I think what we've got in the way of a recommendation here is building training into new starter induction, and as part of a structured learning development program probably makes a lot more sense, and it's much more in tune with the statutory guidance which applies to this area of service. So I think the recommendation reflects that. It's probably better than, I suppose, my initial thought on it. So that's the second recommendation I wanted to comment on. The recommendation 3 is one I want to mention too, and that is the business of having one front door to access services online. So we were talking about that. We wanted a recommendation relating to it. The recommendation actually talks about exploring the feasibility of improving online accessibility. Now, there are some challenges with this, of course, because a number of different organisations provide these services, local authority, health partners, voluntary sector partners as well. And the challenge is how one of those takes ownership of this and makes it work. So I'm a little disappointed at the feedback I've had on that. However, there is an optimistic angle to take on this because the BCF, the Better Care Fund, has a specific work stream around the integration of autism services. So I think, although personally I'm happy with that recommendation, I think if we add to our work stream something around the Better Care Fund and this specific aspect of service, and I think we can possibly draw out a sort of a one route into the service that way, I think, in partnership, because we do know that accessing services and navigating the process across the borough is something that did come out in the witness session. So I think we want to do justice to that as best we can. So my suggestion to the committee this evening is we add that to our work programme, the Better Care Fund aspect of the autism strand, to take that forward. So that's that one. Now, recommendation 8, I'm actually going to move a recommendation and I will explain why that is. Slightly different worded narrative I'm going to suggest. So we do recognise the work that HACS do. They do a tremendous job. There's no argument about that. But also there are a number of partners providers, both statutory and voluntary. And I think what we want to do is allow for a range of partnering and contracting arrangements to improve services for people with autism in the future. So what I'm going to suggest to the committee is a slightly different wording of what's currently at the bottom of page 19 or 41 of the report. So if you look at recommendation 8, above it, it says something slightly different. What I'm going to recommend is that we take the following, and I'll read it to you. It doesn't take too long. So I suggest we replace it with, during the review, the committee heard from representatives of Hillingdon Autistic Care and Support, a charity raising awareness, knowledge and an understanding of autism in the local community. HACS have been improving the quality of life of residents with autism for over 2 decades. The committee felt it absolutely necessary to recognise this work and to also recognise the role that all organisations and providers play in supporting residents with autism. So that's the preamble, if you like, to the recommendation that I'm suggesting we take this evening. The recommendation itself will be more broad than what we've got at the moment, and that is this: that Cabinet recognises all the Council's strong partnership relationships with organisations and providers supporting people with autism, which I think is broadens it out because HACS do an amazing job, but there are other people that we work with as well, and that feels like a better fit for where we are. So I'm going to move that. My very last comment before I shut up and open up for general discussion is around the question of education and healthcare plans and SEND. So there's a fair bit of discussion on that, you recall. Before my time, back in the October meeting, you'll remember there was all sorts of discussion about the difficulty of accessing assessments and services and what have you. You may be wondering why there's no recommendation pertaining to that here. The answer to that, I'm afraid, is that it transpires it wasn't actually part of the scoping of the review. It wasn't within the terms of reference of the review. So therefore, there isn't a recommendation to it. However, there is some good news from Hasrani, and I'm going to share this with you separately outside the meeting, but there's been some significant improvement around the assessments and the accessibility of those. And I think with that information, I'm going to suggest we do bring this item back as a separate piece, as a standalone report, so we can understand more fully how that's improved and have an opportunity to ask questions as well. So I'm going to make that suggestion, that two more things for the work plan out of this particular item. With that, I will shut up and open up for discussion, if that's okay. I hope that's all clear and I hope it all makes sense, but do ask if it doesn't. Any comments? So I've got Councillor, I'm not sure whether Councillor Gardner indicated first, but I'll take Councillor Gardner first, if that's all right.
Yeah, can I just, somewhere in here, is there any way, I know we work with different agencies, but I've got concerns at the moment about the DWP and how they work out the assessments for the children and the adults. I'm dealing with somebody at the moment who's got, well, she's got two children with autism, both heavy duty, and only one was given DLA. And they're two, and they've both got equally the same problems. At the moment, I mean, the CAB are helping with that, but I think it'd be really nice if we could get almost like a DWP advisor on board so that they can actually help. Because, as I say, I don't know that much about filling in DWP forms, especially the DLA. It's very, very difficult for some people if they don't understand what they're doing. And I think a lot of the parents may be losing out. Also, I think some of the adults with autism may be losing out on their entitlements. So is there some way we can put that in there?
Okay. So sorry, you finished, Janet. I'll comment on that.
Sorry.
Okay, no, not at all. No, keep speaking if you've got more to add. But no, if you haven't, I will. I suppose my answer to that is we can look at it certainly. Now, whether it is strictly within the scope of the review, I'm not sure. We'd want some advice on that. But I think irrespective of whether it is, it's something that I think falls within our remit as POC, I would have thought. And we could certainly ask for new information on it. I'm looking at Steve. Any comments, Steve, at all on that?
Yeah, it's just to know that if we were going to, or the work of the DWP would technically fall out of this committee's remit and it would come under external services. Yeah,
external.
But Councillor Gardner was referring to the potential to have an advisor who, if working for the council, would effectively come under the remit of the committee. But it depends on the committee's feelings to that regard.
I'm not sure. Forgive me, Janet. I'm not sure I've quite understood what it is you're suggesting. Then, so would you mind just repeating that, please? Sorry.
There are people that have worked for the DWP who have retired for whatever reason, and there are people that understand all the different systems. So all I've got is the Disability Rights Handbook, which I let people. I give them the details and that. But there are people that have retired who've got a lot of knowledge from how the DWP works, and that they should be able to get around the forms a lot easier than I can.
Right. Okay. So you're suggesting a source of sort of lived experience, if you like, in terms of people who have been through the system who can offer advice and support to people in that set of circumstances. Then, and your suggestion is what then? That we pick this up, or perhaps this committee or whichever committee is appropriate picks that item up as something to look at in more detail. Janet, is that what you're suggesting?
Well, I'll leave it to Steve to work out. But I mean,
yes, okay. I've noted it. I'm sure Steve has. It might be we need to give some thought to that and think about how best to take it forward. But if you're happy to take that, we've noted it and we will feed back in an appropriate way in terms of how it's best taken forward. If you're happy with that, I suggest we leave it there at the moment. If you're okay. I mean, if it were directly relevant to this and we could work in a recommendation, then we'll do it. I'm not wholly convinced we can, but let's look at it offline if I can suggest that, Janet. Is that okay?
Yeah, that's cool. Thank you.
Okay, fine. Tony, you've been patient. Tony Eggerton.
Thank you, Chair. In general, I think I agree with the conclusions and the findings. However, there is one problem which I came across in the last few days, and that concerns a local government and social care ombudsman report. You're probably aware of this, Philip, but certainly I wasn't. It was a complaint which was upheld regarding an autistic person who made a complaint against the council about a year or so ago, more than that actually, it probably took 2 years ago. Sadly, it didn't seem to appear in the annual complaints report which we received. It certainly wasn't in the statistics, it wasn't in the detailed information which we were provided with. It was just a very short paragraph indicating that the Ombudsman had found against the council. But unlike all of the other cases, which gave some detail, there was nothing at all about this. And bearing in mind that it is so relevant, that this is a public document, I hasten to add, so the fact that the person is autistic, has a disability, wasn't treated fairly by the council, suffers from autism, I think at least we should mention it in our report, because otherwise it would seem to be suggesting that either we weren't aware of it, which until yesterday I wasn't, or indeed that we're just ignoring it. And I don't think that would be fair in these circumstances. Bearing in mind that, as far as I can see, all of the requirements have been dealt with, that it was decided, looked at by Cabinet, as you will be aware, back in 2019, but in part 2, so none of the information was available to the public at that time, even though only 2 days later the public document was published. So I'm not quite sure why it went into part 2, but anyway, I think it would be very helpful for our report to at least refer to that and show that we have made progress and the council has adopted some of the things which were proposed. There was one point, and that was that the council, as far as I'm aware, had agreed that it would, or no, it was required to have an equality refresher course for all frontline staff. Now, bearing in mind that this was back in 2019, so we're 2 years on, I wonder whether it would be sensible for us to suggest again that that should happen, that it should be a regular occurrence, because inevitably after 2 years, and particularly with a lot of the staff not having face-to-face contact with with residents, it might be worthwhile. So that was my thoughts on the subject, Philip.
Okay. Well, Tony, if you're talking about something that happened 2 years ago in this area of service, I'll probably have to begin by declaring a non-pecuniary interest since I time. I guess I ought to do that to begin with. I think on the training point, I think the recommendation that we have here is really designed to make sure that that is properly embraced. And I completely agree with you. I mean, training is not a one-off thing you just throw at people willy-nilly. It has to be something that's part of a structured development program and, complements the sort of the skill sets that our people need. So I think that it's very much part of that recommendation. And also, of course, the National Autism Strategy is going to change again. So this is going to have to move forward from here in any case. So I would like to think that that's very much part of what this recommendation is. I don't know if Tony Zaman is on the call, and whether if so, whether he can comment. I don't think he is, so we might have to leave it at that. In terms of including aspects of the Ombudsman complaint, well, my feeling is that once it gets to the Ombudsman, any response on that sort of comes from Ian Anderson rather than anyone else. And quite honestly, I would need to take some advice on that. Steve, you're looking as if you want to say something. Do you want to comment on this, please?
Yeah, I was just going to note, so if the committee did feel like they wanted to mention that incident, obviously it was originally in part 2, and when Cabinet heard it in June 2019, then they resolved to put the local government ombudsman's report into the public domain. So it was part 2 up until that Cabinet meeting, and then following that report was then in the public domain. That's just a clarification with Councillor Egginson there. With regard to mentioning it in the review report, then it would be just a general consent from the committee if they feel like they would like to actually include something referring to that.
Okay, fine. Well, look, I mean, on the face of it, I don't have a particular issue with it, but I do feel I need to get some advice on it. And if before we do that, so I'm minded to say to you, Tony, in response to your suggestion, let's get that advice. And I think delegations allow myself and yourself to agree a way forward in that regard. Would you be happy for me to get that advice and speak to you offline and agree that?
Yeah, sure.
You're happy with that? Yeah. Okay. That might be better, because I appreciate we can do it. Whether we should is another matter, and I can think of no compelling reason why we shouldn't, as I sit here now. But I just want to get some advice and speak to you about it offline, if I may. So if we can agree that, that's fine. Now, I think Steve, you're indicating.
Yeah, just to note that on that note, I can draft something up and then talk to officers.
Yeah.
Draft something up that we could.
Okay.
And then obviously consult Councillor Egginson and yourself to agree it. Indeed. Okay. If we're in agreement with that, did I see someone else indicate? I'm not sure if I did. No, apparently no one's indicating. Okay, fine. Okay. Well, look, I've
spoken on some of the recommendations. I've moved an amendment to recommendation 8. There doesn't seem to be any dissent, and hopefully, Steve, you've captured that. Can we take it that we're agreed on that? Okay, on the recommendations as they are. There are a couple of bits to follow up on. There's Janet's bit relating to the DWP, which we'll pick up, and we'll come back in an appropriate way on that, as we will with Tony's suggestion in relation to the Ombudsman report. So if we're happy that we deal with it in that way, let's agree to move on if that's okay. Happy, everyone? Good, thank you very much. In which case we will move on then to the next item, which is the Housing and Public Health Policy and Review Committee Corporate Parenting Panel Minutes. So this is a relatively new area for me. Although I said when I started chairing this committee, I was familiar with most of the ground. Although we are all corporate parents, this is something I've had less to do with over the years because I've been focused on adults rather than children. But obviously it's for us to take and note these minutes. And I should say, actually, I've been invited to the annual meeting of the corporate parenting panel, which I'm looking forward to because it will be part of my development journey. Any comments on these particular notes at all, on these minutes? Or a couple of indications, right? Okay, Councillor Egginton.
Just thank you. Yes, there were a couple of things which I was going to mention. That yes, I'm sure you would be delighted to attend these meetings. They're much less formal than perhaps, and enjoyable because we have the young people involved. The slight worry which I have, and again it's something which I noticed last week, is that there was an Ofsted inspection of one of the children's homes before the second meeting, so it was just before the February meeting, and even though it hadn't been reported, I'm sure that the staff would have been, the officers would have been involved in knowing what the feedback was. And sadly, there was no reference at the corporate parenting panel meeting of the outcome of that Ofsted visit. Well, it wasn't a visit, it was a virtual visit. But nevertheless, there were some issues which were identified. And I think, bearing in mind that we are all responsible for these children and young people, I think it would be worthwhile if the corporate parenting panel could be at least advised, the members could be advised of such things, because we're now 2 months on since the visit, nearly.
Okay. Okay. I don't know if anyone can comment on that. Steve, any thoughts from Democratic Services why that might not have happened, if that's the case?
I may be able to follow up with that one, but I don't have an answer right now for you, unfortunately.
Okay. I see Tony's name join the meeting, and he's indicating. Can you shed some light on this, Tony, at all?
Not light to respond to it, but what I can say is that I can ask Sandra Taylor to forward you a note, Councillor Corthorne, that you could perhaps share with the committee, because we do have the report. And I'm quite happy that we share the findings. Okay, so
Tony, with that, so once I get
thank you.
Once I get that, I'll share it. So thank you. And I think Councillor Gardner, did you indicate? I thought you had. I beg your pardon. Okay. No other comments on this. Okay. Can I just give a note of thanks to Councillor McQuarrie for helping me with some of the terminology on my learning journey with corporate parenting. So it's something I've got a bit to learn about, but I'm looking forward to it. But it's a new area. It shows it shows that you can teach an old dog new tricks. So I'm looking forward to learning about that. Fantastic. So with that recommendation agreed, can we move on? Okay. Thank you very much. So we move on rapidly, I think, to the forward plan. So I'll move the recommendation and ask if there are any comments on it. If there aren't, I'll just make an observation that I understand the very latest iteration of this now extends to February of next year. and consistent with the undertaking that was made by the new leadership. That will be more detailed moving forward. So I'm hoping that the next one we look at, with any luck, will have a little bit more meat on the bone that we can get our teeth into, as it were. So I'll just make that comment for now. Any comments, any indications on that? No? Are we happy to note that report then? Okay, thank you very much. And then finally, we come to the work programme. That's been discussed a few times this evening. And if you recall, there were three things that have come up. There was Councillor Egginton's point about the energy efficiency feedback that we'd had. So that's something that I'll ask Steve to note. And the other two were mine, relating to the autism review. One was the update on ECHPs and SEND, and also the Better Care Fund aspect that deals with autism integration that I thought we could usefully look at. So if everyone's in agreement with those, everyone seems to be in agreement, and Steve's captured them. Any other points on the work programme for now? There don't seem to be. Okay, so with that, can we agree with the recommendation then? Okay, thank you very much indeed. Unless I'm much mistaken, that concludes our business for this evening. If we can just pause for a moment for the live stream to be cut. Thank you very much, everyone.